How you doing?
Hey, how's it going? Sorry, technical difficulties.
No worries. But I know you're the busiest man in show business today right now. So yeah, let's get right at it. It's been a while. I hope you're doing okay. I see you everywhere on the 20 screens that I have going. So let's start. 18 plus mobile vaccination clinics in hotspots. When could we see that in a mass?
So, the big thing about it is the province kind of surprised us with this announcement. It's a good surprise because it allows us to get out to hotspots and to workplaces. Challenge is we already had a fairly robust mobile and community outreach program going. We've already done 10,000 doses mobile with out in usually it's like apartments and condos with lots of seniors or people that have like shared living situations with medical conditions. So we've been at a lot of hospices, shelters, that kind of stuff. We're in conversations with the province right now, as well as with a number of companies and corporations around both workplace pop-ups as well as community pop-ups. But of course, our current capacity is all committed because we still have a bunch of, seniors apartments and whatnot that we're trying to get into. So hopefully we'll see it just in the coming weeks. And we have commitments from the province to get us some additional resources and into workplaces. But for the time being, the best place for people to keep going if they're eligible is through our mass vaccination sites. We've got people 50 plus booking in there right now, and encourage you, obviously, if you know someone in your life who's that age or over and they need a little help getting there or booking, certainly, reach out and help them as well.
Okay. Also to 45 plus in the mass vaccination clinics, when can we see that? I'm hoping soon.
So we were hoping 45 plus would go at the end of this week, but again, because the province made their change in priority, so now we know that we've also got to get the teachers done just before they return to in-person learning and all that other stuff. Now we've got 4,000 special ed teachers we got to get through the system, and we've got 40,000-ish teachers that we're going to be working on throughout the next little while. So that may delay our push towards 45 plus from the original anticipated date of Friday this week.
Okay, let's talk about schools. You brought up schools. I know this is obviously a massive topic if you have kids. Can we see school being canceled possibly for the rest of the year for in-class learning?
I'm hoping not. I mean, I think to the extent that this is really in all of our hands, twofold. First of all, it's up to all of us to make sure we're staying home, that we are, limiting our contacts, interactions as much as possible, and then for our essential workers who we can't, that we're getting to them with vaccinations, but also with, just safety precautions, investigations, making sure that outbreaks are under control in workplaces, that kind of thing. That's the first thing that's going to hopefully bring the third wave down. But then we also know that we're vaccinating people more and more, and we've actually accomplished some pretty big things in Peel. We've already delivered, as of today, over 300,000 vaccine doses, first doses. We've covered almost 50% of our 60 plus population. So we're making strides, and we know that countries that have hit like 30, 40, 50%, they've started to see changes in their transmission patterns in Israel and the UK. So hopefully we start to get there in our community as well, then maybe, and if we vaccinate the teachers in accordance with a new priority, maybe we get back to in-person school hopefully sooner rather than later.
Okay. Well, one of the major questions that I got asked about 15 times in my Instagram, where I ask a question and it says, get a date from him from when my kids could go back to in-class learning. So no date, or can you give me a date?
Unfortunately, I can't give you a date because the challenge is it's a virus. It's like a snowstorm. I can't negotiate with a snowstorm. I can't negotiate with a virus. So we're gonna have to follow the trends, see what the picture looks like. But trust me, I've got kids and they're at home right now too. And so I mean, the sooner we get back to in-person learning for all the places that we live, the sooner parents will be able to have that load off their mind. But I think the big things, like I said, the quicker we can vaccinate with more supply and opening up more age groups, and then also the sooner we can bring this wave under control, make sure our hospitals don't continue to get overwhelmed and stretched. Hopefully we'll get out of this, and then we can start to gradually reopen schools with confidence.
Now, in regards to opening schools, do all the teachers have to be vaccinated, or more the special ed teachers?
Well, even before we were vaccinated, we were already looking at a staged return to school. We
Okay.
do know, for example, the special ed students receive significant benefit from being there in person with the supports that they have there. That's why special ed has been prioritized for vaccination, and I believe prioritized for return at the provincial level. And we do know that they're a smaller number. So in terms of the the measures that are taken in place to protect people through, personal protective equipment, dismissals, all that other screening. It's easier to do if you're just starting with just the special ed community. But then obviously we had less outbreaks in secondary, so I imagine it'd be something like special ed, then likely secondary, then likely elementary, but of course all dependent on trends and vaccine coverage and where we are in the course of the pandemic.
Okay. After 28 days, after the stay-at-home order, is Peel going to go back into red, you think?
Honestly, it's going to depend. And I mean, I think the big thing is we got to look at the vaccine coverage. We got to make sure that we're getting to levels. And we know that the Premier has committed that by the end of the 28 days that we should be 40% across the province. I'm confident that we're going to meet or possibly even exceed that target here in Peel in terms of 40% of our community covered. But I think that really speaks to the need for people to ensure that they are taking every step they can to stay safe throughout this, to make sure they're staying home as much as possible, limiting contact, masking, distancing, the same stuff I've been saying all along. But then also when their turn comes to get vaccinated, making sure they're going out and getting their vaccine.
Supply vaccine in Peel. Is there enough for everybody that's been registered?
There is enough for everyone that's been registered, and I know there's been a lot of people that have had questions around our vaccine supply. We had that situation where Amazon was shut down and the province offered us 5,000 doses of vaccine. When we actually looked at our numbers, we said, oh, we're actually 80,000 doses short. So never mind the 5,000 doses of vaccine that's going to go to Amazon. That's not going to help those workers anyway because they need to isolate for 2 weeks because of the transmission there. Give us the 80,000 doses that we need. So the province really stepped up and they basically topped up our vaccines over the last few weeks. Now, the big thing, of course, is they need to be able to consistently do that, especially as we're a hotspot, to the extent that we have enough vaccine for everyone that's booked right now. But we can always use more, especially just how quickly this is transmitting. Whatever additional vaccine can be made available to the region of Peel, we would certainly welcome it.
Okay. Major workplace vaccinations. Mayor Crombie told me yesterday, and I think Doug Ford alluded to it in his presser yesterday as well, that I guess major warehouses, super warehouses can actually ask for vaccines and get people vaccinated. Is that true?
Yeah, they can do that through the province's COVID-19 task force, and we work very closely with the province to review any and all requests that come in. We're in conversation with some of the initial companies that have been identified by the province out of that process to figure out how we might get in there. There's a commitment that not only would they be vaccinating their employees, but that they would also be putting up a pop-up clinic to vaccinate the community around them. So as we're getting that stood up, though, the most important thing I'd impress upon people is to really make use of the mass vaccination capacity that we do have out there. Mobile is great. It's going to supplement the capacity we've built, but across our entire system, together with our hospital partners, we have capacity to do 100,000 doses a day, 100,000 doses a week, 100,000 doses a week, so 12,000 doses-ish a day. And that's just, a significant throughput and efficiency. So people who can get to a mass vaccination clinic, that's the fastest and quickest way we'll keep getting through more and more people in our community, while we will deploy these workplaces to the harder to reach populations, absolutely.
Brampton bus drivers have been very much affected by COVID-19. Are they being vaccinated now? Are they on priority?
So transit workers, along with the rest of the essential workforce, meat packers, distribution workers, warehouses, they're all part of this essential worker rollout and campaign that we're undertaking at this point in time. But the reality is, the demand for workplace vaccinations and employee vaccinations far outstrips the current supply. So I think the way we get around it is more supply will let us vaccinate more priority groups, and also just making sure that we're continuing to move quickly through the age brackets on the mass vaccination side, which will cover off more and more of our population as well.
Okay, perfect. Well, one more question. You said this morning in the presser that Brampton has a 20% COVID-19 positivity rate. What are we looking at here in regards to a stay-at-home order? I mean, is 28 days realistic based on this high number, or are we looking at closer to 60?
Well, I think 28 days, provided we continue to get vaccine coverage ramped up, will get us to a point where, again, it's always been about we're seeing we want to get to a place where our cases are coming down and our vaccine coverage is going up. And at some threshold, you're able to start gradually loosening restrictions. So whether we hit that within the next 28 days, or if it's a couple weeks or a few weeks after that, I am very optimistic that this is the last lockdown. That this is probably going to be, it's the same playbook that Israel and the UK followed, where they closed, they vaccinated, and then they exited. And so I think if we can keep up our vaccine efforts, try to bring this wave under control, eventually those lines will cross, and then we'll be able to start reopening stuff, and knowing that it's going to stay open this time rather than go back and forth.
So, Dr. Lowe, are you saying that after 28 days you see the lockdown being lifted? Is that?
I mean, I think that would be a best case scenario, but again, it really depends on what our vaccine coverage looks like and also what our trends look like at 28 days, and especially our hospitals, because as you heard in my presser this morning, we've never seen anything like this at our hospitals right now. The situation is really quite dire. So we know it's going to be about, whatever level we get to with our cases right now, it's going to be about 2 to 3 weeks before we see that crest out in our hospitals, and then hopefully everything starts to come down as our vaccine coverage goes up.
Perfect. Dr. Lowe, thank you very much for taking 15 minutes out of your day. So
awesome, and sorry for the technical difficulties, but always glad to chat with you, Khaled.
All right. Thanks, Dr. Lowe. Take care.
Take care. Bye-bye.
Bye.